Welcome to the HMIS user training on enrolling clients into a program. In this training, we will cover how to enroll a single adult household and a household with children into a program in ClientTrack. Households are comprised of either single individuals or groups of persons who apply together to a continuum project for assistance and who live together in one dwelling. A household without children could be either a one-person single adult household or a household with multiple adults. A household with children is a household with at least one adult and one child. Within each household, the relationship for each household member must be identified in HMIS. For a single household member, the relationship to head of household will always be self. For each remaining household member, the relationship entered will depend on the household composition and how the head of household identifies each of the members. A reminder that an ROI must be signed by all head of households and adult clients ages 18 and above who consents to have their personally identifiable information entered into HMIS, as well as for each individual organization whom the client receives services from. In most cases, each client will have multiple ROIs for each organization they've received services from within the Treasure Coast Homeless Services Council's jurisdiction. When entering an ROI, please ensure that if any children are enrolled into the program, their names should be entered on the ROI for the organization they are being enrolled into. After logging into ClientTrack, navigate to the Client Workspace. Click on Intake to start the enrollment process. Please note, if you are enrolling a client already in the database, you must retrieve the client's profile before enrolling the new client. For this training, we will be enrolling an already existing client. If you are not already on the client profile for the client you will be enrolling, select the Select Another Client button to begin the workflow. To search for a client, enter a combination of the client's personally identifiable information. For example, you'll enter the first 3 letters of the client's last name and the last 4 digits of their social security number. Then click on Search. If the system finds potential matches, the list of matches will display at the bottom of the screen. Carefully check the personally identifiable information for the clients displayed in the search to ensure you don't create a duplicate client profile. For this training, we will be working with Yosemite National. Click on Yosemite National's name. On the client information screen, update the basic client information accordingly if the client reports any changes. Remember, all fields with the red asterisks are required and must be completed before moving on to the next form in the workflow. Once all information has been reviewed and updated if need be, click on Finish to move to the next form in the workflow. After the data is saved to the database, the family member form will open. Since we're only enrolling a single adult, click on the Save and Close button to continue to the next screen. Next, the Program Enrollment screen will open. Select the program the client will be enrolling into from the drop-down menu. Please note that the selected project determines the assessments used within the workflow. Once the project has been selected, the members of the household will appear. Select the member you would like to enroll, then click on Save. Please also note that if you are backdating an enrollment, you will need to ensure that the project start date aligns with the enrollment date for the client. The project start date will automatically default to the current system date. Once all information has been verified, click on Save. The remaining steps in the workflow are assessment forms that users must enter for the client. Assessments are snapshots concerning the client's basic information, including education, income and non-cash benefits, health, and barriers to client success. After completing each assessment, ensure you press either Save or Save and Close to move to the next step in the intake workflow. If you need to return to a previous form in the workflow, click on the name of the form listed in the workflow steps. Users must enter all required fields within each assessment. You will know that all fields within the assessments are complete when there are green check marks next to each assessment form. Once you've completed the workflow, you'll be redirected to the screen that says you're done. Click on Finish and you will be redirected to the client's dashboard where you will see the enrollment you just entered. After logging into Client Track, navigate to the Client Workspace. Click on Intake to start the enrollment process. For this portion of the training, we will be enrolling a household with 2 adults and 2 children into a program. Since we are not enrolling the same client, click on either Add a new client or Search for another client. Before creating a new client profile, the system will prompt users to search for the client's record to avoid duplication. To search, enter a combination of the client's personally identifiable information. For example, you'll enter the first 3 letters of the client's last name and the last 4 digits of their social security number. Then click on Search. If the system finds potential matches, the list of matches will display at the bottom of the screen. Carefully check the personally identifiable information for the clients displayed in the search to ensure you don't create a duplicate client profile. For this training, we will be working with the client Yellowstone National. Click on Yellowstone National's name. On the client information screen, update the basic client information accordingly if the client reports any changes. All fields with the red asterisks are required and must be completed before moving on to the next form in the workflow. Once all information has been reviewed and updated, click on Finish to move to the next form in the workflow. On the Family Members screen, confirm that the persons who will be enrolling with the client are present on this form. If any family members need to be added for the purposes of this enrollment, add them here. For the purposes of this training, there are no additional members in the household at this time that need to be added. Confirm the other family member details, then click on Save and Close. After the data is saved to the database, the HUD program enrollment form will open. Select the project the family will be enrolling into from the Project drop-down menu. After selecting the project, the household form will open at the bottom of the form. From here, you will need to select the family members that will be enrolling into the selected program. In this case, all family members will be enrolling, and you can select the Select All box above the first listed family member. After clicking that, the project start date will automatically populate based on the current system date. Please remember that if the project start date is different than the day you are completing the data entry in the system, you will need to update it here. Once all information is confirmed and as accurate, click on Save. The remaining steps in the workflow are assessment forms that users must complete for each client. Assessments are snapshots concerning the client's basic information, including education, income and non-cash benefits, health, and barriers to client success. Once the assessments are complete for the head of household, you will then complete the assessments for the other household members. Once all assessments have been completed for all family members, you will be taken to the screen that says you're done. Click on Finish to complete the workflow. You will then be redirected to the Head of Households dashboard. From here, you will see the enrollment that was just completed, as well as the total household members, project start date, and how many days the client has been enrolled into the program. This completes the training on program enrollments. For additional questions, comments, or concerns, please reach out to your HMIS support team.